burnt out, stressed, and overworked. A global shortage of nurses has worsened as part of the COVID-19 pandemic. According to the International Council of Nurses, 6 million nurses are needed around the world. And to make matters worse, 5 million are expected to retire in the immediate future. In Israel, there are only 5 nurses per 1,000 people, far below the OECD average of 9.4. The Media Line sat down with Dr. Reli Alon, the head nurse at Hadassah Medical Center in Jerusalem, to discuss this pressing issue and what can be done to resolve it. The COVID-19 pandemic has shed light on the healthcare sector, especially on nurses and doctors, and we know that the nursing sector is facing severe labor shortages across the world. What are you seeing here?
So the first priority in Israel, for example, is the security, with the things we have in the border with our neighbors, and the thing is that they didn't give much budget for this for the health, and this pandemic shows us that when you don't give for many years budget for the health, so when there is a problem, you face a lot of many problems.
How has the COVID-19 pandemic affected this profession? Have you seen fewer people wanting to enter this industry? Have you seen more people wanting to leave?
My nurses at the beginning were terrified, like everyone, from this pandemic. They were really in a lot of stress because of that. Husband doesn't let the women go and see the children because they were afraid they will bring the COVID home. A lot of nurses now want to leave the hospital. Not a lot, but I have a few sessions with the nurses that said, okay, enough. I'm tired. I want to go home, to rest a little bit, to be with my family, to work in the community, not to work so hard, because I asked them to work 7 shifts a week, to work from 7 o'clock in the morning until 12 o'clock at night.
Why did you personally choose to become a nurse?
I was a head of nursing school before I came here, and I think to teach other boys and girls, students, to be nurses in Israel or all over the world, I think it's a mission. It's really the mission that I want to take of myself, and that's why I did that.
What is the ratio of men to women in nursing at Hadassah?
In Israel, it's 19%. It raised up. It was 5 years ago. We were something around 13%, and now it's 19% this year. It's raised up because I think the numbers of nursing in Israel, the students raised up in the last 5 years. We have bonus from the government to have more students. In Hadassah also we have 130% more students of nursing because the shortcut of nursing for all over Israel.
There are many reports that nurses are choosing to leave this profession, especially after these past 2 years that we've had. What have you noticed about this?
Everything is true. We have a lot of burnout. We have a lot of stress. We have a lot of people that said, I'm tired. And I have a nurse that works in the ICU of the COVID for 6 months. And now he said, okay, I want to go back to my hometown. I don't want to work for half a year. He was at home 6 months. He said, I don't want to see patients. Too many patients died. I don't want to see that. And he was at home. I said to him, okay, I'm waiting for you. I'm waiting for you, and I know you will come back. So take your time, and the door is open. And when you decide to come back, I'm waiting for you. And he came back.
And the labor shortage that you've mentioned is not something that's restricted to Israel. It's something that we see across the world. It's a global trend. What do you think can be done to address this shortage?
More money for the health system. Because in Israel, for many years we were starving. And that's especially for years. Nobody take care of the ministry of the health system all over the world. And when they're reminded, and in 2 months, nobody will talk about it. Nobody. In the next year, you're not going to interview anyone from the ministry, from the health system. No one, because the people will forget. We have a very short memory.
What kind of support has been given to nurses to help them cope with the stress and burnout from the pandemic?
I arrange a meeting every week on Monday, 9 o'clock in the morning, we have a meeting with all the head nurses from the COVID. And I was sitting with them, with the head nurses of the hospital, and I was talking with nurses, even those staff nurses. Ask them, tell me how you feel. Give them, for example, a candies. Give them small present. Bring psychologists, social workers to the departments.
What kind of leadership roles do you see women taking on in the healthcare sector?
I think we should learn leadership in the Ministry of Health. I opened for the first time in Israel, in Hadassah, the Center of Leadership, and we are teaching my nurses from the beginning to be a leader. Because you lead the patient treatment, you lead the department, later you need the hospital and the unit that you're in charge of. And I lead them, I teach them tools to be leaders, okay? Because you have to grow up leaders.
Thank you very much, Dr. Alon, for taking the time to sit with us and discuss some of these important issues that are facing women in the nursing sector today.
You're welcome.
From Hadassah Medical Center in Jerusalem, Maya Margit, reporting for the Media Line.